Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And today I'm going to talk about a controversial subject, namely, can patients with functional illness ever be truly disabled? As usual, everything I say is based on my own experience and learning and does not reflect the opinions of the Social Security Administration or any other medical body. I was prompted to tackle this subject by two patients that I've seen fairly recently, both of whom presented with functional illness. They were interspersed in one of my typical Social Security disability exam days where I saw examples of hypochondriasis, malingering, anger, narcissism, folie à deux, and the typical grief and despair and tears over physical disability. Functional illness patients tend to be the red-headed stepchildren of medicine. Medical doctors, after determining that they lack any physical disease, tend to either dismiss them or send them to a psychiatrist. That's rarely successful because these patients are extremely resistant to psychiatric diagnosis and treatment. Psychiatrists throw up their hands and send the patients back to the medical doctors. These patients tend to see a large number of doctors in hopes of finding the holy grail of their correct diagnosis and treatment. They often consume an extraordinary amount of resources, and unfortunately, they are highly at risk for unnecessary surgery, especially surgery where the only indication is pain. And of course, surgery is not the treatment for mental illness unless we're talking about a prefrontal lobotomy. Both of the patients that I saw were middle-aged women, a high-risk group for functional illness. The first was a woman who simply could not stop coming up with more complaints, each one of a more alarming and terrible nature. She kept going for the entire 30 minutes of the exam, which was entirely normal. In fact, on examination, she was the picture of health. She was still coming up with more complaints, graver and graver, as I had to ease her out of the examination room door when I was finished with the exam. To me, this was clearly a psychotic illness. This patient was as out of touch with reality as some of the schizophrenic patients I've seen who are responding to the voices in their head during my examination. When I'm trying to determine if a patient is truly disabled or not, I often pose the question to myself, would I hire this person for a simple entry-level job in my office, for example, as a receptionist? It was clear to me that there was no way that this woman could work at a simple job. The next patient had a far darker presentation. She also was a middle-aged woman with a slew of functional complaints, mostly related to pain in the musculoskeletal system and also headaches. She seemed extraordinarily anxious. She was literally trembling all over as she gave her history. When the history was finished, she told me that being alone in a room with one male, namely myself, made her very anxious. And then the details of her history started to come out. She had an absolutely appalling history of childhood sexual abuse, incest, and torture. As a tribute to her resilience, she told me that she'd actually found a decent man to marry and had quite a happy marriage. But tragically, her husband was stricken with colon cancer and died, and after that, their house burned down. I was able to examine her, but I brought the female medical assistant into the room and she held the patient's hand throughout the examination. It's a tribute to the cupidity of American physicians that this woman had never been referred for therapy or psychiatric care. She'd been prescribed an antidepressant and some Xanax, which were the psychiatric equivalent of prescribing Tylenol for a ruptured appendix. She would have received better care if she'd been, for example, the victim of the Rwandan genocide, because an American charity would have paid for therapy for her. Instead, she was left to her own devices. She jumped like she'd received an electric shock each time I touched her during the exam, cried through half the encounter, and appeared absolutely terrified. I'm no psychiatrist, but I think she has severe post-traumatic stress disorder. Now imagine trying to work this woman into your office as one of your staff members. It would be impossible. There are 3 psychiatric conditions which are vastly overdiagnosed in the United States these days, and they are post-traumatic stress disorder, diagnosed with any patient who's had the slightest upsetting event, or even patients who've never had an upsetting event, attention deficit hyperactivity disorder, an excuse for putting nearly everyone in the population on amphetamines, just like they were in the early 1960s, and bipolar illness. The fact that the most seriously psychiatrically ill, such as the woman I just described, receive no treatment at all is a true indictment of psychiatry in the United States in 2022. This begs the question, can anything be done to help such patients? Well, I think in the second case, the patient would be amenable to seeing a psychiatrist, if only one would be willing to see her. In the first case, I really doubt that she would be amenable to seeing a psychiatrist. However, I've discovered a physician, a Dr. John, J-O-N, Stone, S-T-O-N-E, who's a professor of neurology in Edinburgh, Scotland, who's come up with a novel way to treat patients with functional illness. It amazed me to hear him say that about 30% of patients seen in a neurology clinic practice actually have functional illness, and that functional symptoms often coexist with physical symptoms in the same patient. In my opinion, he's come up with a brilliant way to discuss these diagnoses with his patients, and he has a team who's had amazing success in treatment. I have posted a link to one of his YouTube videos in the description of this video below. Just one more comment. I have a friend who's a psychiatrist with decades of experience, and he agrees that there are patients with functional illness who are simply too ill to work. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.